I think we move on to another session. This is another very good speaker, and the topic is of interest. It is post-COVID complications. For that, I have our chairperson is Dr. Satyendra, and our moderator is Dr. Narsingh Mathur. So over to Dr. Satyendra, please, to go ahead with the topic and introduction of Dr. G.C. Khilnani.
So good afternoon, everyone. Now I would like to welcome Dr. G.C. Khilnani, sir. He is having more than 41-year experience in the pulmonary medicine. He has been chairperson of the PSRI Institute of Pulmonary and Critical Care and Sleep Medicine, chairman of the Committee of Indian Society of Critical Care and Medicine, and senior editor of Critical Care and Lung India. So please, Dr. G.C. Khilnani, sir.
Yeah, so good afternoon. At the outset, I would like to thank Dr. Mehawat and my state people, Jodhpur. I belong to Rajasthan, so it's always a pleasure to be, talking to the people of my own state. And topic given to me is of interest to everybody in the world, not only in India, but in the world. COVID has changed our life. COVID has shattered our life. As many as 45 lakh people have died in the world, and we are still actually struggling. And if you see in India, the positivity rate is going down, and it has come to somewhere around 2%. But look at the United States. This is yesterday's data. In the May, they were cruising, and then after that, they threw away the mask. They started everything. They started nightclub. They started traveling, and where they have reached. But what we are talking today is post-COVID, and this is yesterday's data, where we have more than 3 crore 18 lakh people who are post-COVID, who have recovered in India, and that's what we are going to talk about. But actually, you would agree with me that it's not 3 crore. It could be 10 crore, 15 crore, because the zero surveillance have shown that 2/3 of the Indian population have got antibodies and they are immune, not because of vaccination, because we have just vaccinated 10.5% of the total population as far as the full vaccination is concerned. So there is a huge population of post-COVID people. So what I'm going to talk about is the long-term complications of COVID and how do we manage it. And this is the email which I received about 2 months back from a senior pediatric intensivist from Muscat. And he said, I'm a pediatric intensivist at Muscat. I had mild to moderate COVID 7 weeks ago when I visited India to attend last rites of my father. However, I still continue to have symptoms of pain, heaviness in the left side of the chest, headache, intermittent lightheadedness, easy fatigability, sleep disturbances. I consulted pulmonologist. CT was okay. I did 6-minute walk test and PFT, which was normal. Echo and cardiac enzymes were normal. However, I'm still not able to resume my work as couple of hours of work makes me feel giddy and exhausted and leads to worsening of my chest symptoms. In fact, I felt more sick post-COVID than during acute phase. The work demands are high. I'm not able to help them, and it is very frustrating and depressing. So this is not only one doctor. There are several others, and this is a social media report. Thousands and thousands have been struggling for weeks and months. And this is a lady who says, I have fatigue, I have abdominal pain, nausea, muscle pain, blurred vision, chest pain, brain fog, headache, and breathing difficulty. Please help. This is 104 days after. And yesterday, a paper has come from China, which has said that even after 1 year from discharge from the hospital, more than 50% people are still symptomatic. That's what we are going to talk about. So that is what is called long COVID. The person with symptoms 3 weeks beyond after getting COVID If they continues to have symptoms, that is called long COVID. If they continue beyond 100 days, we call it chronic COVID. So this paper came from Italy. In 2020, we know that Italy had a devastation. When they asked people 60 days, that is 2 months after discharge from the hospital, only 12% said that they were completely all right. 88% said they had some or the other symptoms. And 44% had worsened quality of life. And what were the symptoms? The symptoms were fatigue, dyspnea, joint pains, chest pain, cough, anosmia, dryness, rhinitis, red eyes, headache, sputum production, loss of appetite, sore throat, and diarrhea. So, virtually every system was affected. The question is, why are only some people affected? Is it viremia? No. This is because the inflammatory and other immune reactions are there. There is a deconditioning, and there are mental factors, that is post-traumatic stress. And this is the timeline of post-acute COVID. We all know that virus finishes by 2 weeks. Sometimes the virus may continue for a longer time. And this may, especially in people who are in the ICU, who are on a ventilator, the RT-PCR remains positive for a longer time. But after that, not, none of the organs is spared and every organ is affected. So I'll not be touching upon the pulmonary part of it because my senior Dr. Virendra Singh will be covering that. I'll be focusing on non-pulmonary or extrapulmonary manifest complications of COVID. There are skin changes from petechiae to urticaria to erythematous rashes. Cardiac involvement is extremely important. People have dropped dead while exercising after COVID, probably because of arrhythmias or myocardial infarction. People have had low ejection fraction, there is a myocardial ischemia, and there is clotting. Of course, the diabetes is extremely important because of steroids, but some people develop diabetes even without steroids. Gastrointestinal syndrome, neurological symptoms, I'll be talking in some detail, and some people also have liver and kidney injury. So therefore, no system is spared. There could be impaired fertility. There are a lot of psychological factors. There are immune and hematological derangements. So first I will talk about post-COVID infection. And we were all horrified with this black fungus story. It is actually a new area of concern. And mucormycosis, we all doctors know, that it is not actually a black fungus. It is said because there is some blackish discoloration of eyes and crusting, so it was called black fungus. So it was a catchy term. We also know that mucor is a ubiquitous organism which is present in the air, present in the soil, present in the dirty things. And the number of cases were, number one state was Maharashtra, followed by Gujarat, then Madhya Pradesh, then Haryana, then Delhi. And this is why it is called black fungus, because the main symptom is asymmetrical headache, ptosis, diplopia, running nose with crusting, with blackish or bloody secretion, and if there is a pulmonary mucormycosis, there would be cough with hemoptysis. It has a mortality of 30 to 50% after the diagnosis, but who are at more risk? Patients with uncontrolled diabetes, on steroids, who are immunocompromised, transplant patients, patients with prolonged ICU stay, and some people think that people who are on voriconazole, also that could be a risk factor, but that's not yet certain. The symptoms are, as I said, the sinusitis is the most common. Rhinocerebral mucormycosis is the most common. Asymmetrical facial pain, pain or swelling, discoloration anywhere in the face, as I showed you some picture, blurred or double vision, toothache or loosening of the tooth. If there is a pulmonary mucormycosis, then chest pain, fever, and hemoptysis and pleural effusions are very common. The diagnosis is by nasal endoscopy, most commonly with a biopsy. Some blood investigations are also done. Of course, we know that the treatment is with amphotericin B. There was severe shortage of amphotericin B all over the country because of the outbreak of mucormycosis. We are treating them with posaconazole after the treatment with amphotericin B for a period of 2 to 3 months. It's not that mucor is the only infection. There are other infections that are also very common. This was a 62 years old male who presented 1 month after having seemingly recovered from COVID. He had fever. And when he was admitted, he had leukocytosis. Its CRP was 300. D-dimer was also raised. So X-ray was normal. And we did all the febrile markers, including malaria, were negative. We thought that we are dealing with post-COVID dysregulated syndrome. So we did give him steroids. In 3 days, it did not respond. This was a CT scan, and you can see the classical post-COVID changes which are there. There are fibrotic. So we thought, okay, we are doing well. We have given him steroids. But with 3 days, he did not respond. When we did the CT, he had amoebic liver abscess. Liver abscess, which was then amoebic serology was positive, which actually burst into his pleural cavity also. And you can see this pleural effusion and a little bit of leak there. He didn't require a tube, but he recovered with appropriate treatment. So, what I want to say is that COVID somehow kills our immunity. The infections are more common. Besides this, of course, the respiratory infections I am not talking about because Dr. Virendra Singh will be talking about it. Neurological complications are very common. Besides anosmia and agusia, there are strokes, there are neuropathies, there is brain fog. People say that just now in my OPD I got a school teacher. She said I keep forgetting things. Sleep disturbances are there, neuropathies are there, Guillain-Barré syndrome like syndromes are also there. Besides the strokes are also seen. Among the cardiovascular uh, system, the myocarditis which is seen after vaccination also. And when people did MRI 71 days after the COVID, they found that 78% patient had myocardial inflammation on MRI. This is actually staggering, and that is why so many people complain of chest pain. They complain of shortness of breath. You do a CT scan, which looks okay. The PFT is normal. They are still short of breath. So these are the people who should be subjected to the detailed cardiac evaluation, and that should include the enzymes, cardiac enzymes, ECG, echocardiography, and if there is abnormal, and then a further evaluation should be done. So quickly coming to how do I manage post-COVID complications? I will not be going into the lung complication, which will be dealt by Dr. Virendra Singh, but I will be telling you something. When the patient comes to the OPD after say 4 weeks or 6 weeks after getting COVID, so I look at the temperature, the heart rate and rhythm, blood pressure, respiratory examination, functional status, pulse oximetry, clinical testing. People have so many symptoms. But what I do is that I do their blood investigation, liver function test, renal function test, D-dimer, CRP. To my mind, the CBC, CRP and D-dimer are most important. Rarely I do ferritin also. But when do I get worried? I get worried if there is a worsening breathlessness, if the SpO2 is less than 96%, if there is unexplained chest pain, or there is new onset confusion, or there is focal neurological deficit. So how do I manage long COVID? First and most important thing is the good food and the exercise. And to my mind, the breathing exercise are most important. Yoga and pranayam, to my mind, of course, one can do incentive spirometry, but yoga and pranayam has something to do with mind and the body. So therefore, Kapal Bharati, Vastrika, Brahmari, and Anulom Vilom are the four pranayam to my mind are very, very useful in recovery. Other thing is that which exercise to do. Some people have had mild COVID, they go on for vigorous exercises. As I said, people have dropped dead while going for a marathon running because they thought that they are a marathon runners and they are very good. They just recovered from COVID, they are feeling great. But there is a big no-no for severe exercise. One should go only for gentle exercises, at least for a period of 2 months after recovery from COVID. The importance of diet cannot be overemphasized. You know, a regular vegetable and fruits and a balanced diet is extremely important. The fatigue is very common symptom is fatigue. For that, you need to have a healthy lifestyle, discipline your routine. Whenever you feel fatigue, just take rest for some time. Don't depend on alcohol. Alcohol causes depression and sleep disturbances. Smoking and alcohol must not be done. The sleep should be monitored. Now, fever is one of the most common symptoms that people complain. They feel feverish, they perspire, but when they check the temperature, it is always below 99.6. So, if the person has fever which is above 99.6, then you get a CRP, D-dimer, and CBC done and investigate. Otherwise, there is no need to investigate them. They can just take rest, take paracetamol, follow the healthy lifestyle, and it will become all right. There are a lot of emotional disturbances and anxiety and panic attacks, and that those are actually could be very troubling. For that, you have to regulate your daily routine and sleep habits, do meditation and pranayam, exercise. Alcohol basically is a CNS depressant, so must not be dependent upon to control your emotional disturbances. And if there are disturbances are too severe, then you take assistance of clinical psychologist or psychiatrist. The sleep disturbances has been extremely common during the COVID times, and it is important to understand some people are unable to go to sleep, and some people get up number of times. There's a panic attacks. It is important to follow the sleep hygiene. That is no tea, coffee after 5 p.m. Avoid sleeping during daytime. Sleeping and waking time should be fixed. Finish dinner 3 hours before sleeping time. You can take milk or fruit just before sleeping. Do not see any screen 1 hour before your bedtime. You may read a book and consider taking a warm water shower just before sleeping. That is very important for the COVID. Another question which is asked is, are reinfections occur after COVID? And everybody is scared after one COVID infection that will he have another infection. So everybody is advised to be vaccinated. And this was a large study from Public Health of United Kingdom, which came on 17 June. And they said that there is low risk of COVID reinfection. That is one. Out of 4 million cases, only 15,800 had possible reinfection, and most infections were asymptomatic. So therefore, if you have had COVID infection, take all the precautions, but don't get into panic. And there is no evidence that variants such as Delta are more likely to cause reinfection. So concluding my presentation, the post-COVID complications are very common. The lung involvement is most common. The age, comorbidity, severity of disease, requirement of ICU are important risk factors for complications. Prolonged use of corticosteroids associated with many complications, so that should be uh, kept in mind while treating COVID. And meticulous workup and management is important in management of these patients. I thank you all for your patient listening. Thank you.
Thank you very much, Dr. Khilnani, sir. You have been very precise and accurate. This is the need of the time. People really wanted to know all these details about COVID and the post-COVID syndrome. Uh, Dr. Satyendra, if there are any questions, please go ahead. So muscle pain is another very important concern, and the fatigue is one part, but muscle pains are so common with these patients. Uh, they are not myopathies because the CPK, NAC, and other tests are normal, and they take a very long time. What is your experience about muscle pains in these patients?
So thank you very much. There are two reasons for that. One is that post-viral asthenia, joint pains and muscle pains do occur, and they continue for some period of time. They should be managed at best with paracetamol. But there's another reason for muscle pain that I would must highlight. Majority of patients who have had moderate and severe illness, they are on prolonged doses of steroids. And when you try to taper the steroid, in so many patients, the CRP goes up, they start feeling breathless, they start feeling unwell. And we all have experienced that sometimes the small dosages of steroids have to be continued for a longer period of time. Howsoever slow you may be in tapering the steroid, when you actually stop the steroid, people have extreme asthenia and muscle pain. That is what has been my experience. So therefore, what we do, what I do is that I taper, try to give as small dose of steroid as possible, and I actually bring it to the level of 2.5 milligram of isolone and give it for a 5 to 7 days before stopping. So meaning thereby, even then, my patients do have muscle pains after that. Only I need to counsel them to have good fluids, good food, bear with it, and with the course of time, it will go. Thank you.
Another very important thing which has been come in the media, maybe the doctors are not asking very much, but patients have been asking very often. Smoking helps COVID. This was a common notion for about 3 4 months. You must have had this uh, so many times. Many patients coming and say smoking helps to prevent COVID.
No,
I
I have
don't know.
not
It
come.
doesn't look
I have not
very
come
proper.
across. To best of our mind, only three diseases are there where smoking is supposed to have had some help. That is, one is hypersensitivity pneumonitis, sarcoidosis, and ulcerative colitis. As a physician, we know that, of course. And there's a very sketchy literature about that,
And
about COVID, and maybe some more,
and
but
Parkinsonism.
maybe Parkinsonism. But I
Yeah,
have not heard about
but yes,
COVID, but that's a myth which must be. Uh,
thank you very much, sir.
so thank
So
you.
nice
Thank you
of you
very
to have taken our time.
No, no, no.
We are
My
really
pleasure.
obliged, sir. Thank you very much.
My
Thank you.
pleasure. My pleasure.